As we age, our bodies go through many changes, and these changes can sometimes lead to health issues that might not be immediately obvious. If you're a woman over 60, it's important to stay vigilant about your health, especially when it comes to gynecological concerns. Today we'll be discussing some of the common gynecological issues that can arise after 60, and more importantly, how to detect them early so you can take proactive steps to maintain your well-being. I'm Dr. Lisa Perriera, and I've spent over 30 years in women's health. I'm here to guide you through the often overlooked signs of gynecological issues, offering insights from my decades of experience in caring for women like you. I understand how intimidating it can feel to navigate the many health changes that come with aging, but with the right knowledge, you can empower yourself to take charge of your health. Now let's begin with one of the most common issues that many women face as they age: vaginal dryness. This can be a frustrating and sometimes uncomfortable condition, but it's more than just an inconvenience. Vaginal dryness is often linked to hormonal changes, especially the drop in estrogen that occurs after menopause. This can lead to a thinning of the vaginal walls, making you not engaging in sexual activity. These changes can affect your self-esteem and intimacy, but they're manageable with proper treatment. The good news is that treatment for vaginal dryness can be simple and highly effective. One of the first steps is using over-the-counter moisturizers or lubricants, which can provide relief and restore comfort. If these options don't work, your doctor may recommend prescription treatments such as vaginal estrogen therapy. This treatment can help restore the moisture and elasticity of the vaginal tissues. In some cases, vaginal rejuvenation techniques or pelvic floor therapy may be discussed to help improve overall vaginal health. Before we dive deeper into other gynecological concerns, I want to emphasize how important it is to stay proactive with your health. Don't wait for things to get worse before seeking help. Early detection is key to preventing complications, and your doctor can help guide you through the right treatments and lifestyle changes. I encourage you to subscribe to this channel and leave a comment below if you've experienced any of these symptoms or have questions. We'll be exploring more issues that could arise after 60, so make sure to stay tuned and empowered with knowledge. Let's continue to explore these health concerns together so you can stay informed and confident in your health decisions. Now let's move on to another important issue: urinary incontinence. This condition affects many women after 60, but it's not something to ignore. We'll talk about why it happens, how to identify the early signs, and what you can do to manage it effectively. Urinary incontinence is a condition that many women face after menopause, yet it's often not talked about. It can be embarrassing, but it's more common than you might think. As women age, changes in the pelvic floor muscles and bladder function can lead to involuntary leakage of urine. This may occur when you laugh, sneeze, cough, or even exercise. It's important to recognize the early signs of urinary incontinence so that you can seek treatment before it becomes a bigger issue. One of the first things to notice is if you experience an unexpected leakage of urine during daily activities, especially when you exert pressure on the bladder. This could happen when you're lifting groceries running, or even after a sudden laugh. This is a sign that the muscles controlling your bladder may be weakening, or that the tissues in the pelvic floor are no longer as supportive as they used to be. It's important not to ignore this, as there are plenty of treatments available to help manage and even resolve this issue. There are two common types of urinary incontinence: stress incontinence and urge incontinence. Stress incontinence, as we just discussed, happens when there is physical pressure on the bladder, such as during sneezing, coughing, or lifting. Urge incontinence, on the other hand, occurs when there is a sudden and intense need to urinate that you can't control, often leading to leakage before you can make it to the bathroom. If you notice you're frequently running to the bathroom, or if you're waking up multiple times during the night to urinate, this may be a sign of urge incontinence. This can become more frequent as you age due to changes in the bladder muscles or the need to urinate at night, a condition called nocturia. Both forms of incontinence can be treated with a variety of methods, including pelvic floor exercises, bladder training, or medications prescribed by your healthcare provider. In addition to these lifestyle modifications, can play a significant role in managing incontinence. Maintaining a healthy weight, avoiding bladder irritants like caffeine and alcohol, and practicing good hydration habits can help reduce the frequency and severity of urinary incontinence. Kegel exercises, which involve strengthening the pelvic floor muscles, are an excellent way to improve bladder control. These simple exercises can be done at home and are often recommended by doctors to help manage incontinence symptoms. Another treatment option includes physical therapy, specifically designed to target pelvic floor health. If necessary, your doctor might recommend medications or even surgical interventions in more severe cases. The key to addressing urinary incontinence is recognizing it early and seeking help so you don't have to live with the discomfort or embarrassment it can cause. As we move forward, it's important to also keep an eye on any changes in menstrual patterns, even post-menopause. Though many women think that menopause signals the end of their periods, irregular bleeding can sometimes occur in women over 60, and this is something that should not be overlooked. If you notice any bleeding or spotting after menopause, it's crucial to see a doctor, as it can be a sign of underlying gynecological conditions like endometrial cancer polyps or fibroids. So if you've noticed any urinary issues or changes in your menstrual cycle after 60, remember that you're not alone and there are effective treatments available. Don't hesitate to talk to your healthcare provider about your symptoms. They can help guide you toward the best solution. Next, let's take a look at pelvic organ prolapse, another common condition that affects many women after 60. It's important to understand what it is, how it develops, and what you can do to manage it effectively. Let's dive into that next. Pelvic organ prolapse is a condition where one or more of the pelvic organs, such as the bladder, uterus, or rectum, slip down from their normal position and push against the vaginal wall. This happens because the muscles and ligaments that support these organs weaken over time. It's a condition that's often overlooked, but it can have a significant impact on your quality of life if left untreated. The first sign of pelvic organ prolapse is often a feeling of heaviness or pressure in the pelvic area. You might notice that something feels bulging or falling out of your vagina, particularly when standing for long periods of time or when engaging in physical activity. Some women also experience urinary problems like difficulty urinating or a sense of incomplete bladder emptying, while others may experience constipation or a sensation of rectal pressure. These symptoms occur because the organs are no longer being supported properly. For example, a prolapsed bladder can cause frequent urination or a constant urge to urinate. A prolapsed uterus may cause a visible bulge in the vaginal opening, especially during activities that increase pressure, such as lifting or even during bowel movements. It's important to pay attention to these symptoms as they can worsen over time if not addressed. Pelvic organ prolapse is most common in women who have gone through childbirth, especially if they've had multiple deliveries, or women who have been through menopause. As you age and go through menopause, the body produces less estrogen, which leads to the thinning and weakening of vaginal and pelvic tissues. This can contribute to the development of prolapse. Women who have a history of obesity, chronic coughing, or heavy lifting are also at a higher risk for this condition. Treatment options for pelvic organ prolapse depend on the severity of the condition. In mild cases, pelvic floor exercises such as Kegel exercises can help strengthen the muscles and provide support to the prolapsed organs. In more severe cases, your doctor might recommend a pessary, a device that can be inserted into the vagina to help support the pelvic organs. For more serious cases, surgery may be required to repair or reposition the organs. While the thought of surgery can be daunting, it's important to remember that many women with pelvic organ prolapse can live comfortably with the right treatment plan. Discussing your symptoms with your doctor is the first step toward finding a solution that works for you. Your doctor can help you choose a treatment option that matches your lifestyle and goals so you can regain your comfort and confidence. As we continue exploring gynecological concerns after 60, it's also important to address the risk of gynecological cancers. Though many women feel that their risk of cancer decreases as they age, this is not always the case. In fact, women over 60 can still develop gynecological cancers, including ovarian, uterine, and cervical cancer. Understanding the signs and symptoms of these cancers and staying on top of regular screenings can help with early detection, which is critical for successful treatment. If you experience abnormal bleeding, such as spotting after menopause, or unusually heavy periods, this could be a sign of uterine cancer. Additionally, if you have persistent bloating pelvic pain or changes in your bathroom habits, these can be symptoms of ovarian cancer. Even though these symptoms can be caused by other, less serious conditions, it's important to get them checked out by your doctor. Now that we've touched on some of the key gynecological issues that affect women over 60, it's important to remember that many of these conditions are treatable, and early detection is the key. Your health is important, and it's never too late to take control of it. Keep an open line of communication with your healthcare provider and make sure you're staying on top of your regular checkups and screenings. In the next part, we will discuss the role of regular checkups and screenings in maintaining your gynecological health after 60. Stay tuned to learn how these routine exams can help detect issues early and ensure that you remain healthy and thriving. When it comes to maintaining gynecological health after 60, one of the most powerful tools in your health toolkit is regular checkups and screenings. Many women assume that once they've gone through menopause, they can skip their gynecological visits or screenings. However, continuing to visit your gynecologist is essential in catching potential health issues early when they're most treatable. Regular screenings such as pelvic exams, pap smears, and mammograms are important for staying ahead of any problems that may arise. One of the most common and crucial screenings for women over 60 is the pap smear, which checks for cervical cancer. While the frequency of this screening depends on your individual health history and whether you've had normal results in the past, it's still important to continue with this test as recommended by your doctor. Early detection of abnormal cells in the cervix can significantly reduce your risk of developing cervical cancer. Along with the PAP smear, a pelvic exam is essential for detecting conditions like ovarian cysts, uterine fibroids, and other abnormalities in the reproductive organs. Even if you're no longer having periods or experiencing symptoms, a pelvic exam can reveal changes that might otherwise go unnoticed. If any abnormalities are detected, your doctor may recommend further tests, such as ultrasounds or biopsies, to help diagnose the issue accurately. Breast cancer is another important concern for women over 60, and regular mammograms can help detect it early. While many women feel that the risk decreases with age, breast cancer remains one of the most common cancers in older women. Your doctor may suggest that you continue regular mammograms even after the age of 60, depending on your risk factors and overall health. If you have a family history of breast cancer or other risk factors, your doctor may recommend additional screenings or genetic counseling to better assess your risk. In addition to these exams, maintaining a healthy lifestyle is another crucial aspect of staying healthy after 60. Proper nutrition, regular physical activity, and mental health care all play an important role in keeping your gynecological health in check. Eating a balanced diet rich in fruits, vegetables, and whole grains, as well as staying hydrated, can help support the health of your reproductive system and reduce the risk of conditions like osteoporosis and urinary incontinence. Exercise, particularly pelvic floor exercises, can help strengthen the muscles that support the pelvic organs, preventing or improving conditions like prolapse and incontinence. Additionally, keeping your weight in check and avoiding smoking can help reduce your risk of developing conditions like cervical cancer or uterine cancer. Regular physical activity has also been shown to reduce the risk of heart disease, diabetes, and other chronic conditions that can impact gynecological health. Mental health is just as important as physical health. Many women experience feelings of loneliness, depression, or anxiety as they age, especially after significant life changes like menopause or the loss of a partner. Taking care of your emotional well-being can have a positive impact on your physical health, including your reproductive system. Talking to a counselor or therapist, practicing mindfulness or relaxation techniques, and staying socially active can all help improve your mental health and, in turn, your overall well-being. As we approach the final section of this video, I want to remind you that taking proactive steps to maintain your gynecological health doesn't have to be overwhelming. By staying on top of your regular checkup screenings and healthy lifestyle choices, you can catch potential issues early and live a full, vibrant life. It's never too late to start prioritizing your health. In the next part, we'll wrap up everything we've discussed and take a closer look at the importance of self-care and the support you can find in your healthcare team. Let's finish strong with a focus on taking ownership of your health. As we conclude our discussion on gynecological health after 60, it's important to remember that you are not just an observer of your health, you are the key advocate for it. Taking ownership of your health means understanding the changes happening in your body and being proactive in managing them. It means regular checkups, knowing the signs of common health issues, and most importantly, being empowered to make the best choices for your well-being. Throughout this video, we've discussed several common gynecological issues that women over 60 may face, including vaginal dryness, urinary incontinence, pelvic organ prolapse, and the importance of regular screenings for gynecological cancers. We've also highlighted the role of lifestyle modifications in supporting your overall health, such as maintaining a balanced diet, staying active, and caring for your mental health. Each of these topics is crucial in ensuring you live a healthy, comfortable, and fulfilling life. But beyond the symptoms and treatments, the most important takeaway from today's video is the idea that you have the power to take control. If something feels off or doesn't seem right, don't hesitate to talk to your healthcare provider. Early detection and treatment are the best ways to prevent minor issues from becoming major health concerns. There's no need to suffer in silence, and there's no reason why you should wait for your symptoms to worsen before seeking help. Your healthcare team is there to support you, but they need you to speak up and take charge of your own health. From gynecological exams to lifestyle choices, everything you do plays a role in maintaining your health after 60. You deserve to feel empowered, confident, and informed as you navigate this chapter of your life. I hope today's video has given you some helpful insights into maintaining your gynecological health. Remember, it's never too late to start taking proactive steps. Whether it's discussing symptoms with your doctor, incorporating healthy habits into your daily routine, or simply staying on top of your screenings, you're already making a positive difference in your health. If you found this video helpful, I encourage you to leave a comment below, share your experiences or questions, and subscribe to our channel for more information on women's health. Your health journey is important, and we're here to support you every step of the way. Take care of yourself, stay informed, and remember your health is in your hands.